this is Dr. Mazza from CardioCare Palm Beach. This is the first of a series of cardiology beats in which we will discuss some current topics regarding cardiovascular health and cardiovascular disease. Today, I would like to talk about calcium scores. Recently, there has been an increased public awareness of calcium score as a screening diagnostic testing for atherosclerotic cardiovascular disease. First, let's try to understand what the calcium score means. The heart is surrounded by blood vessels called coronary arteries. The coronary arteries, as well as all the blood vessels in our body, are thin, flexible tubes with a very smooth inner layer called the endothelium. The task to take oxygen to every part of the heart and our body. We need to understand that the heart is beating every second or more of our lives, and oxygenation is crucial for the appropriate working of this complex machine called the heart. These thin and flexible blood vessels can be affected by many factors leading to inflammation and oxidative stress, which eventually will cause damage to the inner layer. When this inner layer is damaged, it leads to a cascade of abnormalities leading to the creation of a plaque or buildup. To put it on an easy way, imagine a highway. A normal highway is open, 4 to 6 lanes. There is no trash or anything that causes any obstruction or build-up either on the shoulders or any of the lanes of the highway. Now imagine the same highway, someone came with a jackhammer and started opening holes. Soon after, there will be more construction workers, and now that area of the highway is not normal anymore. This is how a plaque forms in our coronaries and blood vessels. What happened next? Well, this construction area continues to grow, and in order to avoid an accidental damage to the workers, the equipment, a safety wall gets constructed. In our blood vessels, with the pass of time, in order to stabilize this buildup, a wall starts appearing around the plaque. Calcium is one of the components of this wall. The body does that in order to stabilize the disease so the content of this plaque do not get into the bloodstream and vice versa. So in conclusion, calcium score means that the process of atherosclerosis has there been enough time, and now the body is trying to stabilize the process, constructing these walls which have calcium. Now, these vessels are no longer normal. They are hard, no longer flexible, and with time, the plaque buildup can grow, rupture, leading to obstruction of the flow. When we have calcium score, basically is indicating that atherosclerosis is present. We know that a low calcium score is less concerning than having a very high calcium score. Anyway, I would recommend not to ignore even the lowest amount of calcium. We need to see it as a warning sign that we should enhance our prevention measurements to avoid progression of atherosclerosis. We need to remember that atherosclerosis can affect any blood vessel, not just our heart. Other organs can be affected as well as consequence. Many disease processes like stroke, heart attack, renal dysfunction, peripheral vascular disease, and even dementia can be the result of atherosclerosis. So in conclusion, coronary calcium score is a technique that helps determine if the process of atherosclerosis is present and has been there enough time to produce hardening of the blood vessels. We should see it as an important opportunity for prevention. Very high calcium score indicates advanced coronary atherosclerosis, and further testing may be indicated. Lower calcium score is a great opportunity to enhance prevention. Remember, knowledge is power. These topics are intended for education purposes. I advise you that when you see your doctor, be prepared, have questions, and discuss your concerns. Until the next time, this is Dr. Mazza from CardioCare Palm Beach.